Hello everyone, welcome to my theatre. In this movie, we will be discussing about the anatomy of the retina. We will be dividing the entire movie into 4 sections. In the part 1, we will be discussing about the coronal section. In the coronal section, how the retina appears. In the second part, we will be discussing about the sagittal section. It means how the layers of the retina appear, and what are the layers of the retina. Those things we will be discussing in the part 2. In the part 3, we will be discussing about certain extra point about each layer of the retina. And then finally, in the part 4, we will be discussing about the blood supply of the retina. Okay, so let's begin. First, the coronal section of the retina. How does the retina appear in the coronal section? It appears something like this. So now what is the extent? So this entire thing is the retina. Now if I ask you, what is the extent of the retina? Just look at this picture and tell me, what is the extent of the retina? The retina extends from, see, this is the optic disc, from the margin of the optic disc till the ora serrata. Its extension is from margin till the ora serrata. Now you will say, what about optic disc? This is also part of retina. Yes, optic disc is a specialized part of the retina. It's a bit different and we will be discussing it separately. So in certain places, optic disc is considered as a part of the retina, and in certain places, optic disc is considered as a separate part. We will not enter into this confusion now, and we will keep the optic disc separate. Okay. So the extent is, so what is the extent? The extent is from the optic disc margin till the ora serrata. So the extent is from optic disc margin till ora serrata. Now if I ask you, what's the color of the retina? You will say, ma'am, it's orange. No, it's not that simple. It looks orange, but actually the neurosensory retina is colorless. But then why do we see it as an orange color? It's because of the choroid. The choroid is has a rich vascular network, and because of that rich vascular network, that gives an orange color to the retina. Simultaneously, the outermost layer of the retina, which is the retinal pigment epithelium, also gives some amount of color to the retina. So if I ask you, what is the color of the retina? You will say, ma'am, the neurosensory retina is colorless. So the neurosensory retina, which is actually all the 9 layers, the neurosensory retina is colorless, and the color is given by the choroid and the RPE. So these are the 2 structures which impart the color to the retina. Now the entire retina, we divided the retina into 2 parts for the ease of discussion. It has been divided into 2 parts. So what is the structure that divides the retina into 2 parts? It's the equator. So the retina is divided into 2 parts. One is the central retina and one is the peripheral retina. Okay. So its divided into 2 parts. So we will learn about the peripheral retina, the equator and the central retina. Well, peripheral retina is simple. First, let us know what the equator is. The place where the vortex veins exit the eye is the place of the equator. We have 4 vortex veins which drain the blood out of the eye, and that is the plane of the equator. So here in the picture, this is the equator. So what do we say? It is the place of exit of vortex veins. Okay, so the place of exit of vortex veins is the equator. Now, what is the extent of the peripheral retina? It extends from the equator till the ora serrata. So this is the equator and this is the ora serrata. So this entire part is the peripheral retina. This is the equator and this entire part is the central retina. So when we talk about peripheral retina, it is from equator till ora serrata. And when we talk about the central retina, it is the optic disc and the macula. Central retina is the optic disc and the macula. Okay. So this is how we have divided the retina into the central and the peripheral retina. Now, let's do a few more things. What are those more things? We knew the color, the extent, the division. Now let's know about certain things like what is the AV ratio? In the retina, a very commonly used term is AV ratio. AV ratio is the artery to vein ratio in retina. What is the value? The value of the AV ratio is 2:3. The value of the AV ratio is 2:3. What does it mean? It means the thickness of the artery. If the thickness of the artery is 2 times, then the thickness of the vein is 3 times. Now the question is, how do we remember? Well, I'll tell you certain tips of how to remember and why it actually happens. First is A comes earlier and then comes B. So that is the way to remember that it's 2:3. And second is the fact that the vein doesn't have tunica media. Since the vein doesn't have tunica media, it's very easy for the vein to expand. Since the covering expands, the lumen gets larger. And that is also one of the reasons why the artery is 2 and the vein is 3. And along with that, since deoxygenated blood travels in the vein, it is a bit darker in color, whereas artery is a bit lighter in color. This is how we can differentiate an artery and a vein in the retina. See, here in the picture, if you see, this one is much thicker. You see, the lumen of this is thicker. So this is a vein, and this one is thinner. So this is an artery. So this is how we distinguish between an artery and a vein. Now, so we are actually discussing the concepts. Now, another important concept, how do we know the side of the eye? It means if somebody gives me a fundus picture and I hold the fundus picture in my hand, how do I say whether it's the right eye or the left eye? That I say, I'll tell you a trick here. That I say by knowing the relationship between the optic disc and the macula. If the macula is on the right side of the optic disc, remember, we only have to look at the macula. If the macula is on the right side of the optic disc, then it's a right eye, and if the macula is on the left side of the optic disc, it's a left eye. See, here the macula is on the right side of the optic disc, it's a right eye, and if the macula is on the left side of the optic disc, then it's a left eye. This is how you differentiate between the right eye and the left eye. But now you will tell me, when I am telling about the right side and the left side, I am imagining myself as the patient. So keep that in mind, that if I am the patient, just imagine that I am the patient and I hold the fundus photo like this just in front of me, and if I see that the macula is on the right side, then that is the right eye, and if I see that the macula is on the left side, then that is the left eye of the patient. This is how we know whether it's a right eye or a left eye. Next, so the side of the eye is known by the relationship of the optic nerve and the retina. By the optic nerve and the retina, we know whether it's a right eye or a left eye. Now, what is the color of the macula? The macula is slightly darker than the rest of the retina. The question is why? That is because the macula has more amount of melanin. The macula is thinner number one, and number two is it has more amount of melanin. So because of the melanin, the macula is slightly darker than the rest of the retina. Macula color is slightly darker because of the pigment melanin. Okay, so these are the few important concepts, and now after completing the peripheral part and certain important concepts, next we will move on to the central part of the retina, that is the macula, because macula has so many important things which we need to know. So here we will have a brief introduction about it. What is that? What are the structures that are present in the macula? I'll tell you a mnemonic for that. What is that? You fortunately faced forgiveness. Okay? So actually you did some mistake, but fortunately you faced forgiveness. So I'll write it down. You fortunately faced forgiveness. Okay. So what are the structures? See. In the center we have a depression, that is first is U. So the first structure is the umbo. Okay. Then fortunately, the structure which is around the umbo is the fortunately, F and L, that is foveola. So the structure around the umbo has F and L, which is foveola. And then phased. Phased is phase, F-A-Z, phased, foveal avascular zone. So phased is F-A-Z, that is the foveal avascular zone. And the last one is forgiveness. It has F and it has G, foveola. It has F and it has V, which means it's fovea. It has F and V, which is fovea. So what I want to tell you is that each term, each of the word has multiple alphabets which will help you to remember what exactly they are. U means umbo. Now foveola, it fortunately has F and L, so it is foveola. When we talk about phased, phase, fuzz, so foveal avascular zone. Now when we talk about forgiveness, it is F and V, so it's the fovea. So this is how we remember. Now there's another important thing to remember, and that's the dimension of each part. And what is the dimension? The umbo. What is the dimension of the umbo? It's 0.15 millimeter. The foveola is 0.35 millimeter. And what about the foveal avascular zone and the fovea? Foveal avascular zone is 0.5 millimeter. Fovea is 1.5 millimeter. And finally, the macula is 1.5 millimeter. I told you because this way it's easy to remember. First 0.15 and then 0.35 and then 0.5, then 1.5. See, it's so simple. 0.15, 0.35, 0.5 and 1.5. Okay. So, and finally, the macula is 5. Sorry. Finally, the macula is 5 millimeter. Okay. So this is all about the structures. Now I will show you a picture which shows all these parts, and as I have already told you the mnemonic, with the help of this mnemonic, you can very easily avoid confusion, because this leads to a lot of confusion when we discuss about the central part of the macula, but this mnemonic will help you to avoid all sorts of confusions. See, this is the picture. Okay, so in this picture you see this is the the entire fovea is being taken out. The central part is U, the umbo. This one is the umbo. Then fortunately, that is foveola. So this is the foveola. Then phased, that is phase, that is foveal avascular zone. And then finally the fovea. Okay, and we will not give stress to parafoveal and perifovea because they are two intense. We don't have to really know. So, I mean, we don't have to really go into that depth at this point of our career. And this is the macula, which is 5 millimeter. Okay. Okay. So with this, we had a broad idea about the coronal section in the retina, like when we take a coronal section of the eye, how the retina looks. It's very important to know because this is something that we see. Like when I look at you through a slit lamp or a direct ophthalmoscope, this is, or an indirect ophthalmoscope, then these are the structures that we see. So clinically, it's very important to understand the coronal section of the eye. So we understood about the extent, we understood about its color, we understood about its divisions, how it is divided, and then finally we came into the central part of the retina and we understood the structures that are present in the central part of the retina. So all these things we learned now, which are very important for us. And then in the next movie, we will be learning about the sagittal section of the retina. Let's catch up soon. Don't forget to like, share and subscribe to keep encouraging me. Thank you.